Hello and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I'm your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida, and I am joined by my amazing co-host and talented nurse practitioner, Hope Gulley.
Woohoo! All right.
Here we go. So, episode 7.
Yeah.
All right.
Rocking and rolling.
That's great.
Yeah.
This is going to be a fun one because
I'm excited about this one.
We're calling this one Mythbusters.
Ooh.
So, there's obviously surrounding plastic surgery, even before I knew much about plastic surgery, lots of myths about it.
Totally.
But more and more now that social media is out there,
Yeah.
I think there's a lot of bad information. We talked a little bit about it in the last episode regarding healing and post-op process. But today we're going to tackle those myths.
Yes.
And there's several that, we hear a lot of and we're like, we try not to laugh because some of them are funny.
They're pretty ridiculous, yeah.
But, we're sensitive.
But it's true, yeah.
But it's, we talk about, we try to tell people when they say that, why that just is not true.
Yeah.
So we decided to do an episode completely on that. So if you are a listener, and now you're educated.
Exactly.
And remember, knowing's half the battle, according to G.I. Joe.
True. So what we did was we kind of obviously took things that we hear on a pretty routine basis, like questions and consults or, what have you. But we also had some of our team members to kind of bring in some things that they're like, gosh, I hear this all day, every day. Yeah. So we'll kind of go through the different ones that we hear a lot of and kind of elaborate
maybe
too.
We'll come up with some other ones as
totally.
we talk about this.
Yeah, I think we probably will once we get rolling. So one thing that we hear that's pretty common when we're talking abdominoplasty, right, or a tummy tuck is how do you make my new belly button?
Or am I getting a new belly button?
Am I getting a whole new one? Yeah.
Am I losing my belly button?
What's happening to
I
it?
heard I'm losing my belly button.
It's crazy.
I heard you make a new one.
Yes. So what do you do?
That's a great question. First off, I think anybody can do an okay tummy tuck, right? And so a tummy tuck takes 2 to 2.5 hours, and people can do a really nice job. And at the end, they can really mess it up by not doing a nice belly button.
Yes, we've all seen it.
There are definitely tricks and techniques, and personally, I think we do some of the best belly buttons.
I agree.
But
you do a beautiful job.
Thank you. So the reality is, the myth or the mythbuster is do I keep my belly button or do I get a new one? It's actually both. So one of the things is, so as we're doing the tummy tuck, we make a incision very low, kind of in that bikini line, because we want to keep that hidden. And then we elevate all that tissue up till we get to the belly button. And if we're doing a traditional tummy tuck at that point, we kind of isolate the belly button and leave it connected. And then we continue dissecting and getting rid of, elevating all that tissue up till we get up to kind of that xiphoid process and the ribs here. And then after we do all our muscle repair and we put the patient in a flex position, we pull all that extra tissue down and we trim it off.
Yeah.
So now we've kind of moved all this skin down, and now we need to make a hole, and we actually bring your old belly button through.
Right.
And so again, the answer is both. It's both your old one and it's a new one.
Yes.
And again, how you do that's very important.
Very.
But to answer that question, in a traditional abdominoplasty, a traditional tummy tuck, both. Yes.
Think of it as it's your belly button. It's just in a new home, if that makes sense.
Correct.
Almost.
Or the home around you is different.
Yes, the home around is just a new neighborhood.
It's a new neighborhood.
Yeah, there we go.
A whole bunch of different people moved in.
Yes.
But your house
but you're
stayed where
still
it was.
there. Yeah, exactly.
That's great. I like that.
I like it.
Now, if we do a mini tummy tuck where I'm actually going to float the belly button and bring it with all that tissue and lower it a little bit, then it's still yours, but it's in a different location. Might be a little lower.
Exactly.
And then if we do that, we obviously don't want to lower it too much.
No. Yeah.
So that's a good
natural
myth buster because again, some people come in, or I've had other patients say so I heard I'm going to lose my belly button.
Yeah.
So again, this will answer that myth. And
totally. What about this just brought to mind for me when patients are like, do I need the pearls or the whatever to make sure that my belly button is round and perfect? What do you think about that?
You mean
they have the little, it's these little some places will provide them,
Oh,
but
you mean they put it in
they're
it?
like, in
Oh,
there.
yeah, that's bogus.
Don't do it.
Yeah.
Guys.
Yeah. Again, go on TikTok and there's some weird stuff going on that like you have to put something in it or wrap it in a certain way.
Or else it's going to look weird.
Or put a bolster on it or things like this.
No.
The reality is no. There's a very, there are several different techniques to do it and make it look good. But really what makes a good belly button look good is depth. Which is actually really hard to do in someone who's very skinny. But depth is very good, and you want those edges to kind of roll in.
Yeah.
You don't want something that's super wide, where the incision is now on the outside.
Right.
And you don't want it, again, big, and you don't want it to be like flat. So creating
you don't want it so like a slit either.
That's the other thing.
That's the other.
I've had several patients, and actually some of them have posted on our Instagram, like, no slit,
Yeah,
and
totally.
we see those. So those are actually easier to fix than the real big ones.
Yeah, definitely.
So,
those are challenging.
but we do a fair number of umbilicoplasties
Yes.
For patients who come in who've had tummy tucks elsewhere years ago or out of town, and then we just need to fix their belly button.
Yeah, exactly.
And those are the type of things we do. So that's a good one. Good
Yeah,
myth.
yeah.
Myth number one,
Myth
busted.
number one, done. So let me see. The other ones are really more breast centered. So we'll kind of transition into that realm. But when it comes to like breast augmentations, we get kind of, these are more like, they're myths, FAQs, kind of things that we hear. But what about like breastfeeding, mammograms, like all of those things with implants specifically?
So myth. Hey doc, I want a breast augmentation. Was told that once I get breast augmentation that I'm not going to be able to breastfeed.
Yes.
All right. Great question.
Great question.
Let's bust that myth.
Let's do it. Yeah.
So even though we may put that implant in a different type of pocket, whether it's below the muscle or above it, we are still leaving intact the complete, breast tissue, the ducts and the nipple areola. So anatomically, everything's intact. And that allows a person to have every opportunity to breastfeed.
Right.
Now, anybody who knows anything about breastfeeding knows you could have everything intact, never had surgery before, and you may not be able to breastfeed.
Right.
And that's the physiology side of lactation and being able to breastfeed.
Right.
But
and that can even change kid to kid too.
Yeah.
So it's unpredictable.
Yeah. And honestly, I'll extrapolate that to breast lifts we do and also breast reductions. I've done very big breast reductions. And then the patient's like, do you think I'll be able to breastfeed? I'm like, you can try. And some of them are able to.
Yeah,
so
exactly.
Because we always maintain the ducts going to the nipple areola, and that allows. So that is a good myth debunked. And then the other one is mammograms.
Yeah.
Right?
Yeah. And like, even breast cancer, like because we get a lot of questions about that too, obviously, because there's like such a great emphasis on prevention and everything now too. So like, does breast surgery impact that? Is there a correlation, or like, does it impact your mammogram? How does that work?
Well, I always ask the radiologists, and at our meetings we attend, and currently the techniques we use in breast augmentation or having implants or even any other breast surgery, they are still getting very good, reliable mammograms. And if they're not, they do what's called the gold standard, which is an MRI.
Totally.
And there are some women, based on the density and stuff of their breasts, that they are better off getting an MRI, and the doctors who order that know that. And so, and so basically what I'm trying to say, myth busting, is that you are not necessarily getting inferior breast surveillance if you have breast implants.
Yes,
and in
absolutely.
fact, if you're doing self breast exams, having an implant kind of push your tissue out and have you something to push against, honestly, I think could, again, this is anecdotal, but could, because we have had patients who have implants in who were able to detect on exam lumps or bumps, and that turned into cancer. So who knows? But again, that's a good myth kind of debunked, that, having some type of breast surgery is going to alter surveillance for breast cancer.
Exactly. Perfect. And then, so moving into kind of back into like the surgical side on the breast portion of it.
I know what you're going to say.
Yes. Is if I'm having a breast lift, do you take my nipples off? Do you take my areola off? How does that work?
Sure. So that's another one. So
yeah, that's the big one.
So you're going to have to take my nipples off and on again.
Yes.
And so the reality is 99.9% of the time, we absolutely would not do that. When we are doing a lift or a breast reduction, we kind of isolate the nipple areola and the tissue around it, and we rotate that up into place depending on which different technique we're doing. And so all of the nerve and blood supply stay intact.
Right.
So if your anatomy is built like it should, you should maintain good blood supply and you should maintain good sensation.
Yeah.
Now, that sensation initially might be blunted, so you might be a little numb at first. Or I just had a patient today we did, and she's about a few weeks after surgery, and one side was very, very tender, like super sensitive, and the other side was a little numb.
Yeah.
And that just shows, again, going back to our last episode when we talked about bilateral surgery and things like this, is that, things heal differently.
Different rates. Yeah.
So we do not take them off. Now, there is a procedure called a free nipple graft, which someone who has extremely, extremely large breasts, like almost like a gigantomastia, and we're doing a breast reduction, that if the measurements are so much so that doing a traditional breast reduction would compromise the blood flow to those areas and they would predictably almost not survive, then what this does is it allows us to do a breast reduction and then put them on very similarly to like a skin graft.
Right. Yeah. Right. And those heal very well as well, which is great.
Yes.
Perfect. Yeah. And
but
then
you do lose sensation in that.
You do. Yes.
Yeah. I think I had one patient in my whole career that actually gained sensation back, and I told her she was a miracle. It was
like
a miracle.
A zebra.
Never seen it. Yeah, total zebra.
Exactly. Yeah, that, and I think that's something that's like key in what you just said is the rotation, because that's something that in like your pre-op with us is we'll like draw on you like the pictures that we take of you and show you like this is how we rotate up, because I think that's such an interesting myth to like kind of debunk.
And even though we do that, you don't really know what that looks like until you go in. And that's one of those welcome to the jungles, like from the last episode.
I think every time I'm in the OR with you and we're doing a breast lift, I'm like, this surgery just blows my mind every time, because you're in it and you're like, I mean, this is just awesome.
One of the first surgeries I saw as a student in plastic surgery was a breast reduction, traditional old school inferior pedicle. Like it looked like a bomb went off, and I'm like, how are they going to put this back together? How do they do this? Again?
Yeah, how is this going to look normal?
Together, and then it's a beautiful, elegant surgery. And now I just am blown away that at some point in history, some surgeon who studied anatomy and came up with this. It's just baffling to me.
I mean, like I think you nailed it when you said it's beautiful. Yeah. It's one of those like, I don't know, I've been with you for 4 years now, and it's just like every single time it is the most like beautiful thing. Yeah. So it really does come together. Cool. It's stunning. Okay. So working down the myth busting list here. When it comes to mesh.
Oh.
Yeah. So walk us through, basically the big myth is going to be the mesh that we use, like an internal bra is what we call it. Is that like the permanent mesh I see on the commercials?
You mean like if you've had permanent mesh, you might be entitled to compensation.
Exactly.
That one?
That mesh. Yeah, nailed it.
Yeah, so that's a good point. Yeah. So the mesh that's referring to is permanent mesh made of material that's not going to go away and that can over time erode into different body parts. Now, there is certainly in certain surgeries done in the body, not done by me, but certain hernias and stuff like that, where you need to use permanent mesh.
Totally.
So
have to have that.
But regarding what you're talking about, with the internal bra becoming so popular, and there are different types of material used for internal bra. Those meshes are all what we call bioabsorbable or bioincorporate, meaning your body ultimately will grow into it, break it down, and replace it with its own tissue.
Right.
So that is a very thing, because as soon as I say the word mesh, like patients just go again to that commercial.
Totally. Every time. Yeah.
But once I tell them that it's actually made of the same, one of the meshes we use is made of the same suture material.
Right.
And then there are other ones that are, cadaveric, decellularized skin or animal skin that's been decellularized, depending on what we're doing. But ultimately it all gets incorporated and kind of broken down.
Right. Yeah. And maybe that's a good way to like talk about it too, is like, when would you use that and who would like be a good candidate for that?
Sure. If I get a patient who, let's say, has had breast augmentation and we have like complete loss of pocket control and like the breasts are either down or to the side, and
Yeah.
we need them up higher and like for like ever.
Yeah.
I'll tend to use what's called acellular dermal matrices
Yeah.
there, which are decellularized, either human or animal skin, because those form really well internal bras.
Yeah.
And then your body, again, really kind of maintains that and just replaces it. But it's very, very durable. It's also very expensive.
Yes.
The step down is someone who needs some pocket control, implant control, a little longer. I would use something product called Galaflex for that.
Yeah.
Lasts a little longer. Takes 6 to 8 months, or maybe even a little less than that to kind of completely go away.
Yeah.
But most of the time when we're using like a mesh to kind of support the inframammary fold, like a true internal bra, we're using something called Dorazorb, which again is very similar to the suture material you use, and the body breaks it down within a few months.
Yeah.
But it does nicely support that internal mammary fold so that the implant doesn't drop too much. So it's sort of like an insurance policy.
Yeah.
And that would be good on patients who either are weight loss patients and don't and so we don't rely on the skin to support the implant, or patients that don't really have much of a native inframammary fold, and the weight of that implant is just going to cause it to bottom out sooner than later. So it's been very popular. We've had really nice success with it, and a lot of my colleagues use it well.
Yeah. Perfect. Yeah. I think that's always like great information, especially for patients where you're like, wait, but I had a augmentation, but I didn't get mesh. What does that mean? You know? Perfect. And then we're kind of rounding third on our Mythbusters time here. So, on the kind of like topic of implants, the myth is that implants are good forever.
Oh, yes.
Yeah. So kind of walk us through current implants.
Sure.
What's the lifespan?
So, I think
myth,
back in the day when implants were, the first or second generation implants, particularly talking about silicone implants, and we were seeing shell degeneration leading to rupture. And at the time it was like liquid silicone or silicone that wasn't very cohesive and can kind of spill out and cause a lot of inflammation.
Right.
Or other problems. They were telling patients you should get them changed every 10 years. All right. So we have plenty of patients that come in, hey, I had my implants placed, 10 years ago, I'm here to do it. And then we're going to do a removal and replacement. But the newer implants, the generation 5, 6 ones, which are more of a cohesive gel, like a solid.
Right.
And the shells, I think, are a little bit more durable. I've been telling patients 20 plus years.
Yeah.
And the reality is it could be much longer.
For sure.
It's just that these haven't been on the market that long.
Yeah.
And of course, a saline implant, like I had a patient with a 20 plus year saline implant. And usually what'll happen again is the shells wear down over time, a patient will wake up and it'll be deflated.
Yeah.
And because it's salt water, you'll just absorb it. But you'll know at that point you need to have them exchanged.
Right.
But again, the kind of myth is, it's not really a myth, but it's like, I guess it's patients coming in like, I know I need to change these every 10 years. And the reality is you don't.
No.
With the newer implants, they'll last a lot longer.
Yeah. And especially if we aren't having any concerns, issues, complications, anything like that, you can really ride the implants out, which is pretty great.
Yeah. Excellent.
Awesome. And then last but not least is the myth is you cannot do an augmentation and a lift at the same time.
Wow. Let's go back to 1960s.
Let's go.
So I'm sort of on the tail of the old school training, where some of my professors in training did have that mentality. Like they were worried so much about the blood supply to the breast that they were like, well, we either have to do the lift first or the augmentation first, and then come back a month or 3 months later and do the other one.
Gotcha.
And the reality is a lot of patients didn't like that.
Yeah.
Now, that's not an excuse to do things that are unsafe.
Sure.
But what we have done, and through anatomical dissections, also there's real-time laser angiography you can do on the table for certain procedures, is they've studied the breast during augmentation mastopexy at the same time and saw that, no, you can very safely do this. And in fact, right now, I can't even remember the last time I staged one.
Right. I was just thinking that.
I
don't remember.
All at the same time. Now, it makes it a lot harder.
Yeah.
And this is where experience matters, because the more and more you do, the more and more you get, the more and more you can kind of have an idea, because it's a lot of moving parts, right? You're making in one part bigger, and the other part you're trying to make it smaller and kind of lasso it all in. And then you have to kind of predict settling of the implant. How much is the skin and breast tissue going to stretch? So it's a very challenging operation that, a small percentage of the time you have to do little tweaks afterwards. But that's far better than two big separate surgeries.
Totally.
Adding cost, recovery, and like unnecessary things like that. So it's one of those things that, like, I think that's something, again, is kind of phasing out more and more, because I think a lot of the older guards are retiring.
Right.
But anybody coming out of training these days, or anybody I teach, or any of my patients, you say like, we can absolutely do it.
Absolutely.
But again, there are probably going to be some exceptions, and these would be right now, I would say, very, very massive weight loss patients. Like we're talking 100, 200, 300 pounds, where that the breast tissue envelope is just so much so that it might be a little dicey to do it all at once.
Right.
And so those are patients who might be better off with a delay, but I can't remember the last time we did one.
Yeah.
So,
and that's where like the consult comes into play too, is, we'll always walk you through
that's a good
those options.
myth busted.
Yeah. Busted. Yeah. Awesome. But that was
Excellent.
Our last one. Well, perfect.
So I think maybe in another episode, because we could talk about this stuff all day.
Forever.
Literally.
Yeah.
We could talk about myth busting fillers, myth busting Botox, myth busting vaginal rejuvenation, myth busting non-surgical stuff, cool sculpting, everything.
Totally.
So we will probably hit those as we hit those individual topics, but this was a good surgical one.
Absolutely.
To kind of just, again, as people talk to other people or go on social media or Dr. Google, that they're able to now have a little bit of knowledge.
Right, exactly.
Anyway, cool. Perfect.
Well, hey, busted some myths today. Not too bad.
All right, cool. Well,
awesome.
It's that time again.
Everyone's favorite time.
To talk about our question of the day.
Yes. All right, it's your turn this time.
All right. Well, this was actually given to me by one of my techs at the hospital the other day.
Okay.
And it was really great, because I rarely get stumped or speechless. And I was like, But
what do I do?
The question is, if you could go back during your lifetime, so the years from when you're born moving forward, and bring back something that doesn't exist right now, and it could be a restaurant, a food, a band, an artist, not a family member, because that's everybody would want their grandpa back.
Yeah, totally. Yeah, for
but
sure.
Something like that, where it's just like, oh man, I wish that was still around, or something you maybe never got a chance to experience.
Oh, goodness gracious, that's a good question. That is a stump question.
Yeah,
it makes you like flashback to your whole life.
Well, I'll tell you mine.
Yeah,
while you think.
while I'm pondering. Yeah,
because I have the opportunity to think about this.
Right.
Now, regardless about what you think about him as a person, as an artist, I really wish I could have seen Michael Jackson perform, either with the Jackson 5 or by himself. In fact, my wife did get to see the Jackson 5 perform in the 80s, I think. And it's just one of those things.
What an experience,
like, what an icon. Yeah. And every one of the songs are great. It's
so
just
good.
Just one of those things. It's like, if I could bring back something like that.
Just just to experience it.
Yeah.
Just once, you know. Well, mine's not as cool as Michael Jackson, but I think what came to my mind like initially was growing up, our family went to this one restaurant for everything, like your birthday, like all the stuff. It was this like just small little Chinese restaurant, amazing, called Ming's. Shout out to Ming's, which is no longer anymore. But we
this is in Alabama.
This is in Alabama.
They
this
have
is
Chinese
in Montgomery.
food in
We do. It's in questionable sources for sure.
Is it real Chinese food?
I can confidently say no. But it was so good. And my dad let us know like a couple months ago that it closed, and all of us were like, what? We didn't get to go back,
Too bad.
So I would bring it back for one more family meal, and then it can go back to being close.
All right, ladies and gentlemen, if you see Ming's out there, go check it out.
Yes, I'm going to say bring it back to us.
And shout out to Ming's in Alabama.
Yeah.
Sure,
and all the joy it brought us.
Egg rolls. And
it was so good. No, I want Chinese.
Excellent.
Awesome.
All right, well, so great episode.
Yeah.
Lots of fun.
It was a good one.
Again, if you have ideas, comments, you want to tell us about your favorite Chinese restaurant in Alabama, let us know.
Yes.
info@patrickbasilmd.com.
Yes.
And we look forward to hearing from you. And then Hope, thanks so much.
Thanks so much, Dr.
All right,
B.
we'll see you in the next one.
Awesome.